Welcome to all my dears. We had completed the portions of inflammatory bowel disorders regarding its etiology, etipathology, clinical features, investigations, diagnosis, etc. 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 So, today we are discussing about the homeopathic management or homeopathic treatment in irritable bowel syndrome. As you know, there are so many homeopathic remedies in homeopathic system of treatment for irritable bowel syndrome. Let me try to explain regarding the most commonly indicated constitutional or polycrust remedies as well as acute remedies which may help in our clinical practice. Regarding the constitutional treatment, as you know, homeopathy treats the individuals or individualistic level of diseases or disorders or the syndromes. In inflammatory bowel disorders, you may get a set of symptoms or cluster of symptoms, but at the same time, the cause of the disease may be different from each and every patient. According to homeopathic system of treatment, we have to treat the cause and not the disease. That means removal of the cause itself remove the disease. In such a way, we had treated our patients individually or a concept of holistic or a personalized treatment with homeopathy. Let us look at the polycrust, which are the polycrust remedies commonly indicated in homeopathic system of treatment. The number one medicine is the king of polycrust, as you know, the sulphur. Then comes the true workaholic, king of workaholic remedy, the Naxomica. Number 3, the weathercock remedy, our pulsatilla. Then very quick, impulsive or quick to response, rapid execution of our phosphorus. Then our hepatobiliary king, Lycopodium, Silesia, and very frustrating, very busy, very hurried personalities of Argenta nitricum, etc. The acute medicines like asafoetida, colocynth, lilium teak, natrum carb, podophyllum, aloes, etc. plays great important role in the day-to-day management of inflammatory bowel disorders. So, let me try to explain with sulphur. As you know, the sulphur is one of the commonly indicated homeopathic medicine for wide range of GIT disorders, especially including irritable bowel syndrome. It's a true polycrustic remedy having an influence on various systems of body other than GIT like skin, urinary system, respiratory system, reproductive system, etc. In patient with IBS, sulphur is frequently prescribed for the following symptoms. That is, our patient will have a frequent but unsuccessful desire for stools. Here, in sulfur patient, the stools are very hard, knotty and insufficient also. Along with the constipation, it alternates with the diarrhea. And diarrhea is particularly a nature of early morning diarrhea. There is very severe urge to pass stool, so that's why immediately after waking, the patient has to rush to pass stools directly to the washrooms. And our sulfur patient is having a sense of heaviness in the abdomen as of a lump, and at the same time the abdomen is very sore and very sensitive to touch or to pressure. This remedy is mostly suited in a very thin and weak individuals who are very sensitive to heat. Sulfur is suited with the mental symptoms of who are nearly always irritated and always very sensitive and always very depressed also. And they are very forgetful also. The sulfur patient seems to very too busy, or they are very dare to lazy and not to feel like doing work. And some of them may have a feeling that they are immensely wealthy, when in reality the situation is very opposite. So sulfur is commonly indicated in psoriatic miasms with a very sensitive personalities, with a mentally irritable and with symptoms of alternative diarrhea and constipation, with the symptoms of a sense of lump or heaviness in the abdomen, and in a very thin personalities. These are the main characteristic personalities of a sulfur patient with a irritable bowel syndrome. Next, about pulsatilla, I think that can be studied in next class. Thank you for watching.